All right, welcome back. Of course, if the 2009 population and housing census is anything to go by, Kenya indeed has registered a massive population growth. But its dream of becoming a developed world is proving to be a challenge due to poverty and, of course, income disparities. To tell us more about the situation on the ground in terms of the population growth and, of course, the place of development is Director General, National Council for Population and Development, Dr. Boniface Koyugi. Welcome to the Power Breakfast Show.
Thank you very much.
All right. So perhaps just to give us background information briefly, what does the National Council for Population and Development focus on? What does it focus on?
Yes, thank you. The National Council for Population and Development was established in 1982, and that was after the 1979 population census, which gave us a medal that we should have done without, in the sense that we were found to be having one of the highest population growth rates in the world.
In the world.
Right. So that became a matter of concern because the rate of the economic growth and the resources were not as fast as what the population growth rate was. So it was established in 1982 solely to be able to manage the population growth rate so that it can be in tandem with the resources that are available for development. Mm-hmm. Yeah, and just to give you a quick picture, you know, at the time of our independence in 1963, you are aware we were colonized by Britain. Now, the population of Britain that time, in 1963, and the population of Britain now, as we speak today, is just only about 1.5 times what it was in 1963.
Kenya?
Now, for the Kenyan's case, mm-hmm. we are about 5 times.
5 times.
So what it simply means that you and me have to work 5 times as hard to be able to maintain and be able to have a good standard of living. So that is the challenge.
You know, just looking at the situation on the ground, of course, you as a National Council for Population and Development has been doing a great deal of things. Last year you organized workshops to sensitize grassroots leaders in places like Rarieda and Malindi, among other places, on the relationship between population growth and development. Do people really understand the relationship of these two ideals, population and development?
That is our greatest challenge, and we are happy that the message is sinking, in the sense that population is a development issue. Quite a number of people would just associate it with the health. But here in Kenya, we look at it as a development issue, in the sense that it has an impact. For instance, let me use a very simple example to illustrate. When a pregnancy occurs in a household, in under just a few months, either the government or the household start incurring some expenses, because you have to go for the medical checkups. And when the baby eventually arrives, there are also other costs associated with the coming of the new baby. Although you celebrate you have a newborn in the family, but there are costs that are associated with that. And within a short while, that baby has to go to kindergarten. Mm-hmm. And then, you know, the cost of education.
Absolutely.
If you want to give your child the best. So, and then it's not only the education, there's the food, there's the health. And they are all myriad of things. Very soon, the baby, the one person who was a baby at some point will now require some space, additional, a fraction of your land, so that they can be able to have their livelihood. So it has an impact in each and every aspect of our development. Mm-hmm. So that is the message we are trying to bring up front, so that our communities can be able to see the very wide dimension of how population affects the entire sphere of our development.
Of course, the Tupange project
Yes.
has been on the forefront in terms of increasing the contraceptive prevalence rate in 3 sites, that Nairobi included, and of course there's a target of the cycle is actually running up to 2015. But the place of introducing contraceptives to communities that believe in children are prestige, a sign of prestige, and the place of, you know, I'm in a slum and perhaps I'm not working and I have to have children and God will just provide for them. How do you handle such perceptions?
I'll give you a bit of the background how even the Tupange, which is one of the projects that we support to implement, came about. Way back about 7 years ago, the federal government of Germany came on board to help us do what we call to provide reproductive health. We were piloting a project which was very unique. Usually the case, you go to a health facility and you find a doctor waiting and the facility is there for you waiting to give you service. But the approach that was coming in, a financing mechanism, was whereby you don't have to start by constructing a hospital or a facility. You only have a contract with already existing facility. They provide the service. After they provide the service and the client is satisfied, then you pay for that services rendered. So meaning you only pay for services rendered. You don't pay to maintain a medical doctor, a nurse, and all the other bunch of the service providers and facilities. So that was referred to as the output-based approach to reproductive health. We piloted it and now handed it over about a year ago to the former Ministry of Public Health and Sanitation to now upscale it. It's now one of the flagship projects in Kenya. Now, as we were piloting that project, we had a few urban areas which were in place, and Nairobi being one of them, the Korogoshos and the rest. We noticed that in the slum communities, they were worse off in terms of the indicators when compared to the rural areas. So when the Bill Gates came in with the Tupange project, we directed them that is the place to go, so that because they were the urban poor were the forgotten one. So that's how the urban poor came into being. Now, the perception of the value of children is something that stemmed up from is the historical in nature, in the sense that in the traditional setup, wealth used to flow from children to parents, in the sense that children were the ones who were providing labor in the garden. They are the ones who would herd the animals. They are the ones that would do everything to support the parents. Eventually, when they start work elsewhere, it was their obligation to be sending resources to support the parents. Unfortunately, as development continues, and as we scale to the new scales of development, the case is reversed. Now wealth flows from parents to the children. You start with supporting the child when the child is born, and even when they finish school, you still go. So now, that was what was fueling the high birth rates. One of the reasons why, if you are going to benefit, then the more you have, the better. Okay, but for now, that direction of wealth has changed, according to the data and the dynamics that we see. We call it there's a theory behind it known as the wealth flow theory, whereby now it is reversed from children to what? From initially it was from children to parents, but right. Now it's from parents to children. So now the more you have, if you have limited means of supporting them, the more issues that they will have to bring to your mind, and you will having to be living very tightly to be able to support them.
Right. Just to take you back, there was an article last year that was posted on the Daily Nation titled "Plans to Tame Kenya's Exploding Population." And the writer termed you specifically as a distressed policymaker among a group of experts who have formulated various family planning measures that only serve as short-term solutions. So the question is that the situation? And is there any long-term solution to population growth in the country?
Thank you. I think that is just a misunderstanding of the situation. I will look you straight in the eye and tell you the best contraceptive is development. In the sense that if we want to manage population growth rates, there are two variables or factors which are very critical. Education, especially of the girls, and income. When the education is improved beyond secondary, the desire to have large family size diminishes. When the incomes improve tremendously, then the desire to have large family size also diminishes. So that is the best what you can call long-term contraception. And it is something that the government of Kenya, and especially from our perspective from the National Council for Population Development, what is being done. But hardly people talk about it, because the spirit of this free primary school is to ensure that children can go beyond primary. Now we are also having subsidized secondary. So when that happens, then naturally the data shows those with the secondary and above level of education have fewer children. Those that have higher incomes have fewer children. Now, but we also need a short-term measure, which is contraception. That is a short-term measure. So it is something that can be able to help us attain that target very quickly. So we are pursuing both fronts. So the population policy that we have in place is a broad, wide-range policy that looks at measures that need to be supported for the long term to manage the population, which is basically the socioeconomic development, and the short term is the contraception.
The contraception.
Right.
Right. Just to take you back, of course, you've spoken about the policy. The government last year in October launched the population policy for national development. And if I may just pick something that former Permanent Secretary Edward Sambili said, he said there's need to find innovative ways of communicating to the youth rather than just telling them to have families that they can manage. So there's the place of telling people, you know what, have smaller families. But then the question is, what are you doing to make it very practical for these families to actually have smaller families?
Yeah, what the former Permanent Secretary, Dr. Sambili, put it was very simple. When you have a mission to accomplish, and you find that the strategies that you are using is not yielding the results that you desire very quickly, logically, you have to change strategy.
The tactic.
The tactic. So what it simply means that the old ways of communication with the young people must now change, because the environment is completely different. Now we have the Facebook, we have the mobile phones. These were not there 10, 15 years ago. So, and they are very effective means of communication. Anywhere you go, you'll find